should the medical record be owned by the patient? And there's a general consensus that it should, but it's not really. And I think we'll know it is at the point where the patient has access to the entire medical record, every note, every piece of information that's on it. They become the carrier of it, not the HIE. So they're the ones who are going from physician to physician or system to system, and they're granting access to those systems. They're essentially going, hey, you're gonna care for me for the next year. I'm going to give you access to my medical record for the next year so that you can be a part of it. And they share it. Your system takes it in. You care for them for the year and add to that medical record, but it all goes back to them. And then they control it. They sit there and go, hey, you know what? I want to participate in this cancer study. And they go, I'll share my information over there. I get, $25 for that. And I'll share it with this heart study. That's another $25. And people can then start to feel good about contributing back to society, but also getting financially compensated. Do you think a model like that is possible, or how far away do you think a model like that would be?
I think the devil's in the details on something like that. Philosophically, I agree with it. And I love the idea of the patient really owning their record, not just so from the ownership perspective, but what it would signal to me is they're more engaged in exactly what's happening. And one of the big challenges we have in medicine, of course, is having doctors communicate with doctors effectively. And if the patient's more engaged in that process, I think they can encourage that communication. But the devil is in the details. So let's say the patient owns the record and has access to the record and can even edit the record.
Ooh, yeah, that becomes a challenge.
Yeah, and if you look at the major vendors right now, they're providing that capacity within the patient portals. So then what do you do with that information? That I think one of the things that docs count on as they interact with a patient's chart is that the other person writing it, that person is accountable for what they wrote 100%. And I can hold them accountable. And I actually know that guy because we go to lunch together or whatever. And so you have this kind of a relationship. If the patient can edit the record, I think the level of confidence in what's in there will be changed.
Right, but there's a way to handle that. I think the simple way to handle that is to document the source of the data, right? So, and we had to do this within our systems, especially our HIE and other things, because to be honest, I mean, doctors don't trust other doctors in some cases. So they wanted to know what doctor put that information in, and then they would look at it and go, I don't trust his data anyway. And so they can then make their determination based on that. But we could do that with patient data as well, because we did that with demographic data.
Yeah.
If they say, hey, I have a new address, we say, patient entered data, new address, which triggered in our processes, what it triggered was a verification phone call to that person to say, hey, we noticed you updated this information. Is it accurate? They say yes. Once it gets verified, then it becomes part of our record system of record.
Yeah, that makes perfect sense. And the other way to do it is to have the patient be able to add but not delete. So if you can add and you know who it's coming from, you can see what that is, but you can't delete something that was there before, that might help as well.